Hey everyone, today we're going to talk about something that can bring up a lot of worry, finding a lump in your breast. So we've put together a kind of field guide to the most common benign findings. The whole point here is to demystify this stuff and honestly, just dial down the anxiety a bit. Let's get into it. So you find something. For most of us, the mind it goes there, right? Straight to the worst case scenario. And that's a completely normal human reaction. It's the not knowing that's often the toughest part. But this right here, this is the crucial thing to hold on to. While you should absolutely get any new finding checked out by a doctor, the odds are overwhelmingly on your side that it's something harmless. And you know what? Understanding what those harmless things are is the best first step to managing that fear. Okay, so let's start our field guide with the biggest and most common group of benign lumps, the ones that are basically made of fatty tissue. These show up in breast imaging all the time. Doctors have this list they call the classic 5 fatty lesions. You can think of them as the usual suspects. And the good news is, every single one of them is benign. We're going to go through each one so you know what's what. First on the list is something called an oil cyst or fat necrosis. This is just what happens when some fatty tissue gets walled off, maybe from an injury or surgery you don't even remember. But here's the cool part, a little inside baseball from radiologists. They have this buzzword for it: eggshell calcification. Over time, this thin, hard shell forms around the cyst, and on a mammogram, it looks exactly like that. It's a dead giveaway that it's benign. And here's another fantastic medical buzzword for you. This one is for something called a hamartoma. Radiologists literally call it a breast within a breast because that's what it looks like on the mammogram, a little island of perfectly normal breast tissue that's just kind of hanging out on its own. It's a really distinct and totally reassuring thing to see. The other 3 fatty lumps are also really straightforward. A galactocele, it's just a milk-filled cyst that you see in young women, usually when they're done lactating. An intramammary lymph node is just that, a normal lymph node that happens to be in the breast. And a lipoma is just a simple, common fatty tumor that doctors usually only biopsy if it decides to get bigger. All right, on to our next category. Lumps that have these incredibly intimidating names, but the diagnosis itself really isn't. Let's be honest, medical jargon can be a huge source of anxiety all on its own. So let's break down one of the worst offenders. Just look at that. Pseudoangiomatous stromal hyperplasia. It's a mouthful, right? Can you imagine hearing your doctor say you have that? It would be pretty unsettling, to say the least. But here's the reality. The name is literally the scariest thing about it. It's just a fancy way of saying there's a harmless, non-cancerous overgrowth of tissue in the breast. That's all. It is a perfect example of a bark being way, way worse than its bite. And this is why having the facts is so important. Yeah, these can get pretty big, but see how they have well-defined borders? They're really common in women from 18 to 50, and the typical recommendation is just an annual follow-up, just to keep an eye on things. That's it. Next up is a name that you might have actually heard before, the fibroadenoma. If you're a younger woman and you find a lump, statistically speaking, this is the most likely thing it could be. It's a completely benign, solid tumor, and it is incredibly common. And we've got another great buzzword here. As a fibroadenoma gets older, especially in older women, it can start to develop these coarse, chunky calcifications, and on a mammogram, they look just like popcorn. It's another one of those very clear signs that tells a doctor, hey, this has been here a long time, and it's benign. So far, pretty much everything we've talked about has been completely harmless. But there is one condition that needs to be watched a little more closely. It can feel a lot like a fibroadenoma, but it behaves differently. This is the number to remember, 10%. About 10% of what are called Phyllodes tumors have the potential to become malignant. And that's why, even though the other 90% are benign, doctors take these very seriously. So the really critical thing is telling these two apart, and this table lays it out perfectly. Fibroadenomas, common in younger women, they grow slowly, if at all. Phyllodes tumors, on the other hand, tend to show up in women in their 40s and 50s, and they're known for growing fast. And because of that 10% risk, you see the treatment is very different. They need to be surgically removed with wide, clear margins around them. Okay, so you found something. What actually happens next? The whole investigation process can feel like a black box, but there's a pretty standard path that doctors usually follow. Here's how it usually plays out. Once a lump is found, the first tool doctors reach for is an ultrasound. In fact, for patients under 30, they often just skip the mammogram and go right to the ultrasound. And here's a really important takeaway. If a mammogram is done and it clearly shows one of those classic benign fatty lesions we talked about at the start, that could be the end of it. No more imaging needed. If there's one thing to take away from all this, it's that knowledge is your best friend. Understanding the language, understanding the possibilities, understanding the process, it just takes away the unknown. And when you get rid of the unknown, a lot of the anxiety goes with it. So we'll leave you with a question to think about. Now that you know these terms, fatty lesion, fibroadenoma, even the difference between slow and rapid growth, what's one question you feel like you could ask your doctor now that you might not have before? This new vocabulary can totally change the conversation you have about your own health. Thanks for watching.